Today's case is a 13-year-old male who came with abdominal pain and right iliac fossa tenderness. An appendectomy was performed, and here is the biopsy. Here we can appreciate the surface epithelium and crypts, and the lamina propria of the appendix has dense lymphoid tissue, and here we can appreciate the germinal center, and here is the lymphoid tissue. Here again we can appreciate the crypts and the lymphoid tissue, which are composed of mature lymphocytes. What we see here is the dark nuclei of the mature lymphocytes. The cytoplasm is very scant, so not appreciable, containing lymphoid tissue. Here we can appreciate the smooth muscle layer, which has moderate cytoplasm and is elongated nucleus. And here we can appreciate an eosinophil, this bilobed nucleus and abundant eosinophilic cytoplasm. So the presence of this acute inflammatory cell defines appendicitis. So if neutrophils are present in the muscle layer, then it defines acute appendicitis. Lymphoid tissue can be normally seen in the lamina propria. So it is the presence of acute inflammatory cells in the muscle layer that is significant. Now let us have a look at the lumen. We can appreciate these structures here and these exudates. Let us have a close look at these structures. These are Enterobius vermicularis. They are characterized by the presence of this lateral spine-like position or lateral alley. Here again we can see this lateral spine-like position or lateral alley. Here again another Enterobius vermicularis with the visceral organs and these lateral spine-like positions or lateral alley. Here again another Enterobius vermicularis with lateral spine-like positions or lateral alley. Another defining feature of this Enterobius vermicularis is the presence of these characteristic eggs, which are 50 to 60 to 20 to 30 micrometer in size, and they are flattened on one side and rounded on other sides. So these characteristic eggs, which are flattened on one side, rounded on other sides, and 50 to 60 by 20 to 30 micrometer in size, which are partially embryonated. So the characteristic feature of Enterobius vermicularis is the presence of lateral spine-like projections or lateral alley, and the presence of these eggs, which are 50 to 60 by 20 to 30 micrometer in size, flattened on one side and rounded on other sides, which are partially embryonated eggs. Again these eggs, which are 15 to 60 by 20 to 30 micrometer in size, flattened on one side and rounded on other sides. So the presence of lateral alley and the characteristics eggs, we can identify the Enterobius vermicularis species. So these are all about Enterobius vermicularis. Please subscribe for more videos like this.